What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my biochemistry playlist. In previous videos, we talked about metabolism, we talked about glycolysis and gluconeogenesis. We talked about the Krebs cycle and the electron transport chain. Please recall that substrate level phosphorylation takes place in glycolysis, but oxidative phosphorylation takes place in the TCA cycle and the electron transport chain. Then we talked about lipid metabolism, lipogenesis and lipolysis. We talked about protein metabolism, proteogenesis and proteolysis. And we talked about ketone bodies, ketogenesis and ketogenolysis. Then we started talking about diseases, such as lactose intolerance, disorders of fructose metabolism, and disorders of lactose metabolism, such as lactose intolerance. Then we started discussing glycogen storage diseases. We talked about all the famous types, type 1, type 2, type 3, type 4, type 5, and today it's time for glycogen storage disease type 6, also known as ERS disease, which is characterized by hepatomegaly. So remember, hepatomegaly is seen in ERS disease. Click the like button, click the subscribe button, and let's get started. What is glycogen? Glycogen is a big sugar that you can store in your liver and or in your muscle. Then, in times of need, you can break down this big glycogen into smaller glucose and utilize that small glucose for energy. There is another video titled Glycogen Metabolism in this biochemistry playlist, which goes into great details about glycogenesis and glycogenolysis. What are these glycogen storage diseases? Glycogen storage disease type 1 is Von-Gierke, type 2 is Pompe's disease, type 3 is Cori, type 4 is Andersen, type 5 is McArdle, and type 6 is ERS disease. If the genie came to me and said to me, "Hey Medicosis, you have been cursed by a glycogen storage disease, which one would you choose?" Well, I hate all of them. If I have to choose, I'll go with Cori, or glycogen storage disease type 3. Why is that? Because it's a mild disease. For sure, I will not choose type 4 or Andersen. That's evil. This can lead to death early in childhood. So these are the most important glycogen storage diseases, but these are not all of them. In fact, there are about 15 or so, maybe more today, glycogen storage diseases. These are the ones that we'll discuss. All of them are autosomal recessive, although be careful because some of them can have more than one pattern of inheritance. These disease symptoms usually manifest themselves in infancy or early childhood. There is no predilection towards females or males. Now let's memorize one or two things about each disease. Von-Gierke's disease is the most common, although some textbooks will claim that type 6 is now the most common. Von-Gierke is the one that affects the liver. It has high uric acid, which increases the risk of gout, and it can have anemia. Next, type 2 is Pompe's disease. Pompe, remember the pump, the heart, cardiomyopathy, arrhythmias, etc. Type 3 is Cori, a very mild disease. That's why I drew a smaller liver relative to Von-Gierke. Symptoms are similar, but Von-Gierke is way more severe than Cori disease. Type 4 is Andersen, pure evil, cirrhosis, ascites, splenomegaly, and it can lead to early death. Type 5 is McArdle. McArdle, remember skeletal muscles, which will lead to generalized muscle weakness all over the body. Type 6 symptoms are similar to type 1. Now let's talk about glycogen. Glycogen is what? It's a big sugar. The big sugar stored in animals is glycogen. In plants, starch. Now let's review what we've said before about the difference between insulin world and glucagon world. If you want to see more videos like this in the future, please drop a sandwich emoji in the comments. Insulin is the land of abundance. When you eat, when you are in the feeding state, well, you have too much stuff. So you can afford to store it for later. Amino acids can be built up into proteins. Glucose will be built up into glycogen, i.e. the small sugar will be converted to the big sugar for storage. Use me for the now, glycolysis, or store me for the morrow, glycogen synthesis or glycogenesis. And let's store the free fatty acids as big triglycerides. So insulin is anabolic. It's a builder. It's in the feeding land. But in the land of fasting or starvation, it's the story of glucagon and epinephrine and basically almost every other hormone except insulin Insulin alone is here. Every other hormone is almost anti-insulin. So glucagon, break down because I'm starving. I need readily available sources of energy right now. Break down the proteins into amino acids and then take those amino acids with some free fatty acids. You can make glucose from non-carbohydrate sources, i.e. new sources. Gluconeogenesis. I will make glucose from new sources. Break down that glycogen into glucose in a process known as glycogenolysis. So in the feeding state, insulin will help you build up glycogen. #Glycogenesis. But in the fasting state, glucagon will help you break down glycogen. #Glycogenolysis. What's the key enzyme in glycogen synthesis? Glycogen synthase. What's the key enzyme in glycogen breakdown? Glycogen phosphorylase. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. How did insulin activate the former, glycogen synthase, by dephosphorylating that enzyme? But how does glucagon activate the glycogen phosphorylase? By phosphorylating it. Now let's take it up a notch. Here is glycogen built up. It's the land of insulin. But glycogen catabolism is the land of glucagon. Name the process, glycogen synthesis or glycogenesis. Name the process, glycogenolysis. Name the key rate-limiting enzyme, glycogen synthase versus glycogen phosphorylase. That's the most important enzyme here and the most important enzyme here. What's the second most important enzyme? If you're trying to build up, it's the branching enzyme. It adds branches. But how about the glycogen breakdown? It's a debranching enzyme. We're trying to break down, so you remove a branch. When you remove a branch or when you break down a bond in the presence of water, it's hydrolysis, so debranching enzyme has a hydrolase activity. So it's the feeding state versus the fasting state, the land of insulin versus the land of glucagon, the land of abundance versus the land of scarcity, anabolism stan versus catabolism stan. When you're trying to make a bond, usually it's a condensation reaction. Add this small sugar to this small sugar. Before you know it, you have a big sugar. But when you're trying to break down, you start with a big molecule, in this case it's glycogen, and you break it down into glucose, etc. So this is hydrolysis. Condensation versus hydrolysis. You're adding water in hydrolysis, but in condensation, water leaves the chat. So glucose up to glycogen. This is anabolism. Insulin stan. Insulin is helping the glycogen synthase. How? By dephosphorylating it. How about the fasting state? Glucagon is helping glycogen phosphorylase. How? By phosphorylating it. Now let's imagine that I have a glycogen storage disease. I cannot utilize glycogen. Do you think I'll be able to break it down into glucose when I need it? No. So I'll suffer big time during the fasting state, because it's during the fasting state that you need to break down glycogen into glucose. What's going to happen in the fasting state if I cannot break down glycogen to glucose? You will have low blood sugar, fasting hypoglycemia, and you will have tons of glycogen that you could not break down. Glycogen accumulation in organs such as the liver, hepatomegaly, the heart, cardiomyopathy, the muscle myopathy. My liver can suffer from enlargement or even cirrhosis. My heart can suffer arrhythmia and weak pumping, and my muscles will be weak, and I will be exercise intolerant. All of these are symptoms of glycogen storage diseases, because medicine makes so much sense once you understand what the flip you're talking about. For the gazillionth time, insulin comes from the beta cell of the pancreas. It is the building state, the feeding state, dephosphorylates the key rate-limiting enzyme. Glucagon comes from the alpha cell of the islets of Langerhans in the pancreas. It will phosphorylate the key rate-limiting enzyme. It's released in the fasting state. So insulin helps glycogen synthase by dephosphorylating it, i.e. removing a phosphate. Glucagon is helping glycogen phosphorylase by adding a phosphate. phosphorylation. There is another enzyme that takes that phosphate and literally adds it to the glycogen phosphorylase to activate it, and this is known as glycogen phosphorylase kinase, which adds a phosphate to glycogen phosphorylase, ergo glycogen phosphorylase kinase. A kinase is an enzyme that adds a phosphate. Notice that glucagon, the land of starvation, adds a phosphate. So if I see tons of phosphate in your cell, it means that you are starving. Accumulation of cellular phosphate is a starvation signal, signifying prolonged fasting. Do you see this? This is a carbohydrate, a sugar made of only 3 carbons, i.e. a triose. How about my glucose? No, glucose has 6 carbons. It's a hexose. When I'm joining together glucose molecules in order to make glycogen, how do I bind the glucose molecules together? By glycosidic linkages, covalent bonds. So here is a glycosyl residue, another glycosyl residue, bind them together by a glycosidic bond. So let's join some monosaccharides together to make disaccharides and then polysaccharides. So let's join 2 monosaccharides together to make 1 disaccharide. Monosaccharide plus monosaccharide, thank you glycosidic bond, water leaves the chat because this is dehydration, i.e. condensation reaction. Now you have a disaccharide. Keep adding them together, glycosidic bond, condensation, water leaves, you end up with a polysaccharide. This is a glucose. This is a glycogen. Look at that. Here is 1 monosaccharide. Here is another monosaccharide. And we're doing what? Joining them together. Glycosidic bond. You end up with disaccharide. In this example, if the bond is between 1 and 4, it's a maltose or syllabiose. Which picture is this one? This is a beta configuration, so this is syllabiose. But if it's alpha, then it's maltose. To understand the difference between the alpha and the beta, check out my biochemistry playlist for MCAT, especially my video on the chair configuration. Can you give me some examples of polysaccharides? We have cellulose, plants, starch, plants, glycogen, animals. Look at the starch in plants, alpha 1 and 4 glycosidic bonds. Okay. But look at glycogen, also alpha 1 and 4 glycosidic bonds. And it branches up or down at alpha 1 and 6 glycosidic bonds. So if you keep adding glucose, 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 glucose in series like this, horizontally so to speak, you're using alpha 1 and 4. But to add a branch above it or below it, you will be branching at alpha 1 and 6. Let's build up glycogen. You need glycogen synthase, that's the main enzyme. What's the second most important? Branching enzyme. Let's do the opposite, glycogen to glucose. Alright, I will need glycogen phosphorylase, that's the key rate limiting enzyme. I'll need a debranching enzyme, and the last step is to convert glucose 6-phosphate into glucose. How do you do that? Just remove a phosphate. How do you remove a phosphate? Phosphatase. I'm removing a phosphatase from carbon number 6 of glucose, so it's glucose 6-phosphatase. What are the names of the organs that have glycogen in them? Liver, that's the most important one, and the muscle. But there is a huge difference between the two. You see this last enzyme? It's only present in the liver, not in the muscle, which means the only organ that can give you free glucose without phosphate is the liver. The muscle can never do it. And that's why when the liver breaks down its own glycogen, it can give you pure glucose for your blood, which will go to every other organ. Heart, brain, muscles, kidneys, you name it. But when the muscle breaks down its own glycogen, it will go all the way until glucose 6-phosphate and stop because the muscle lacks the enzyme, glucose 6-phosphatase, necessary to convert glucose 6-phosphate into glucose, which means glucose 6-phosphate will end up being trapped in the muscle because phosphorylation fixes stuff. This glucose 6-phosphate is fixed in the muscle. It can never leave, which means the muscle glycogen can never serve as a source of glucose for your blood. Put differently, the liver is altruistic, but the muscle is egotistic. The liver's glycogen will give glucose to every organ, but the muscle's glycogen gives energy only for the muscle. Greedy. And that's why in type 1 glycogen storage disease, Von-Gierke's, the patient suffers from what? Fasting hypoglycemia. Because now the liver lacks this enzyme and cannot provide us with glucose for the blood. So during fasting, the patient suffers from low glucose in the blood. Contrast that with type 5 glycogen storage disease, McArdle disease, where the problem is in the muscle glycogen phosphorylase. Do you think this muscle will be able to break down its glycogen to glucose 6-phosphate? No, so the muscles will be weak. But will my serum glucose be affected? No, because the muscle never gave us glucose. So if the muscle is screwed up, tough on the muscle, but not on the rest of the body. If the muscle is suffering, but the liver is healthy, the liver will give me glucose for the blood and I will not suffer from fasting hypoglycemia. Medicine makes so much sense once you understand what the flip you're talking about. I am showing you this slide just to tell you that the word amylose, amylopectin, etc. refers to what? Big sugar. Dextrin is also another word to associate with carbohydrate. In the feeding state, insulin approves this message. Let's make glucose into glucose 6-phosphate. How do I do this? Hexokinase or glucokinase. And then glucose 6-phosphate into glucose 1-phosphate. Oh, so the phosphate jumped from 6 to carbon number 1? Exactly. What's the name of this mutating enzyme? Phosphoglucomutase. Then glucose 1-phosphate through many steps will give us glycogen. Thank you, glycogen synthase. Thank you, branching enzyme. Now we have glycogen, okay? However, in the fasting state, epinephrine and glucagon approve this message, glycogen phosphorylase, debranching enzyme. Glycogen becomes glucose 1-phosphate, and then by the same mutase, glucose 6-phosphate. By the key enzyme glucose 6-phosphatase, part of gluconeogenesis and glycogenolysis, you convert glucose 6-phosphate into glucose by removing a phosphate group. There is another alpha-glucosidase in the lysosome. The lysosome is full of acids, that's why they call it lysosomal acid alpha-glucosidase, which is still a debranching enzyme, so to speak. We can call it lysosomal alpha-1 and 4 glucosidase. It has alpha-1 and 4 activity and alpha-1 and 6 activity, just like a good old debranching enzyme. The key concept in many of these glycogen storage diseases is that I either cannot make glycogen or, more commonly, cannot break down glycogen into glucose. And of course, if I cannot make glycogen, I will not be able to utilize glycogen later. No input, no output. The end result is whenever I fast, I cannot break down glycogen to glucose, so I get fasting hypoglycemia. All of that glycogen will accumulate in my liver, hepatomegaly, or in my muscle problems, or in the heart, cardiomyopathy. Since this process of glycogenolysis is normally responsible for providing my blood with glucose in the first 48 hours after my last meal, these patients will suffer symptoms of hypoglycemia in the first 48 hours after their last meal. It could be anywhere from here to here. Within all of that range, the most common part will be here. So within half a day to 1.5 days of the patient's last meal, the patient will suffer the most. What's the normal? The liver stores glycogen for the blood. What's the abnormal in these glycogen storage diseases? Fasting hypoglycemia. What's the normal? The skeletal muscle stores glycogen, and this glycogen is only for the muscle. The muscle is egotistic. So therefore, glycogen storage diseases that affect the muscle will lead to muscle weakness because the muscle cannot utilize glycogen as a source of energy for itself. But the diseases that affect the muscles only, like McArdle disease, usually do not have fasting hypoglycemia. Next, red blood cells do not store glycogen. That's why in these glycogen storage diseases, you will never hear of hemolytic anemia. But hey, medicosis, Von-Gierke's disease might have anemia. Yeah, anemia. We do not know its cause, but it's not hemolytic anemia. Even if it is hemolytic anemia, every rule has exception. So these are the 6 glycogen storage diseases. Von-Gierke's disease is missing glucose 6-phosphatase, and we call this type 1. How about type 2? Pompe's disease. Think of Pompe, pump. The problem is in the heart's lysosomal acid alpha-glucosidase. You can also call it alpha-1 and 4 glucosidase. Some books will even call it just debranching enzyme, which is fair enough. Type 3, which is Cori, is a problem in the debranching enzyme. Type 4 is Andersen, is a problem in the branching enzyme. No input, no output. You know who's trapped in the liver? Glucose 1-phosphate. If you're phosphorylated, you're trapped. These liver cells will be toast, and the patient can develop cirrhosis. Andersen is evil. McArdle disease is a problem in the glycogen phosphorylase only of the muscle. So I get what? Muscle weakness. How about type 6, which is ERS disease? Same glycogen phosphorylase, but the one that's in the liver. So you get hepatomegaly and fasting hypoglycemia. Complications of all of these glycogen storage diseases include liver failure and cirrhosis, arrhythmia and cardiomyopathy, as well as muscle weakness and muscle destruction. How can we diagnose? You can look for the abnormal gene on its corresponding chromosome, and you can measure the level of the enzyme. It will be lacking. For example, Von-Gierke's disease will have very low levels of glucose 6-phosphatase. And since in almost all of them, glycogen keeps piling up and accumulating, you can test for this by the periodic acid Schiff immunohistochemical technique. PAS loves sugar. And if you have too much of it, you will be PAS positive. Management. Well, since fasting hypoglycemia is a common concern, keep the patient on a diet that provides regular glucose supplement. Do not let the patient fast for a long time. If you can give the patient the enzyme that is missing, that's amazing. When the liver is toast, it's time for liver transplant. When the heart is toast, it's time for heart transplant. Before the heart is toast, if it's just arrhythmia, you can add a pacemaker. In the upcoming videos, we'll talk about each of these diseases in detail with a mnemonic. Glycogen Storage Disease type 6, ERS disease. Where's the problem? PYG. Is it M like McArdle? No, it's PYGL. On the long arm of chromosome 14, what's the enzyme deficiency? Liver glycogen phosphorylase, not the muscle. McArdle was the muscle glycogen phosphorylase deficiency, but ERS disease, H for hepatocyte glycogen phosphorylase deficiency. What's going on? I cannot break down glycogen into glucose, therefore glycogen will accumulate in the liver. Hepatomegaly. I cannot make glycogen into glucose. Fasting hypoglycemia. Maybe failure to thrive. When I cannot utilize the sugar, I will shift towards the fat, lipolysis, causing hyperlipidemia and ketosis. Management. Special diet. Do not let your patient fast, otherwise fasting hypoglycemia can develop, and try to replace the missing enzyme. Here is a mnemonic for ERS disease or glycogen storage disease type 6. Where's the problem? Lack of hepatocyte glycogen phosphorylase enzyme. Not the muscle one, the liver one. The muscle one was missing in McArdle disease or type 5, but the hepatocyte one is missing in ERS disease or type 6. If I cannot break down glycogen, i.e. there is no glycogenolysis, all of that glycogen will accumulate in my liver, hepatomegaly, PAS positive accumulation of glycogen. Can I break down that glycogen? No, fasting hypoglycemia. If you go back and watch my previous videos, I have a mnemonic for each one of these glycogen storage diseases. So there is a mnemonic for Von-Gierke, another for Pompe's, another for Cori, etc. By watching all my glycogen storage diseases videos, you should be able to answer all of these questions. If you can answer them, please let me know in the comments. And let's see who's gonna get the correct answers first. If you like this video, you will enjoy my endocrine pharmacology course. It will teach you about the different types of insulin, calculating the dose of insulin for your patient with diabetes, the difference between type 1 and type 2 diabetes, as well as diabetic ketoacidosis. Download it today at medicosisperfectionalis.com. To learn about diabetes of pregnancy, gestational diabetes, and to learn about preeclampsia, eclampsia, acute fatty liver of pregnancy, the liver diseases that happen in pregnancy or around pregnancy, download my OBGYN high yields course at medicosisperfectionalis.com. Help me make more videos like this by supporting my channel. Go to buymeacoffee.com/medicosis. There are more than 600 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal or Venmo. Go to my website to download my courses, notes and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.